Our next presentation is from Child and Adolescent Health Service. So I'd like to introduce Shahira Bain, Fran, and Elise onto the stage.
Good morning. Thank you, Jenny. I will wait for Elise and Fran to join and introduce ourselves. Beautiful. Okay, sorry, I will get started. So welcome to the information session on the Child and Adolescent Health Service Transition to Practice programs that we have available. To begin with, I would just like to acknowledge the traditional custodians of the various lands on which we work and pay my respects to elders past and present. Now, a little bit about us and why we exist. We serve all children and young people across WA so they can achieve their best health and well-being now and into the future. Out of that, we have developed a set of strategic objectives that provide a clear direction for our core services with a focus of continuous quality improvement, excellence and innovation. Our objectives are to care for children, young people and families, value and respect our people, provide high-value healthcare, promote teaching, training and research, and lastly, collaborate with our key support partners. At CAHS, we strive to exemplify 6 core values: compassion, collaboration, respect, equity, accountability, and excellence in all we do as we work toward our vision of healthy kids and healthy communities. Our values were chosen by our people, and we aspire to live them in all aspects of our work and interactions with each other and our patients, clients, and families. So on that note, my name is Shahira Bain. I am the nurse educator for the Perth Children's Hospital stream of the CAHS Transition to Practice program. And with me on stage, I've got Fran, who is the Child and Adolescent Mental Health stream nurse educator, and also Elise, who is our Community Health nurse educator as well for the Transition to Practice stream. We are a statewide service consisting of 174 facilities, which include 153 metro community health sites. We have 13 child and adolescent mental health services, 6 Perth Children's Hospital neonatology and outreach services, and 2 combined or co-located CAMS and community health co-located services. Quite a nice wide service. When you apply for the CAHS Transition to Practice program, there are 3 streams available, and within the services at CAHS we cover neonatology, which provides statewide specialised neonatal services to meet the needs of newborn babies and infants who need specialist treatment in their first months of life. Neonatology operates neonatal intensive care units at PCH and King Eddies, and the Newborn Emergency Transport Service, which is a mobile intensive care unit. The Child and Adolescent Mental Health Service, or CAMS as you might hear it referred to, provides specialist public mental health community services across the Perth and metropolitan area, and statewide inpatient and specialised services for children and adolescents with moderate to severe and complex mental health conditions. Our community health, or what you might hear referred to as CAHS, it provides a comprehensive range of community-based early identification and intervention services to children, young people and their families across the Perth metropolitan area. And then, of course, we also have the Perth Children's Hospital, which is WA's only dedicated paediatric hospital. It provides medical care to children and adolescents who are 15 years old or under, and the hospital provides inpatient, ambulatory and outpatient services and is WA's only paediatric trauma centre. So the way the Transition to Practice program streams work within CAHS is, as you can see there, you've got the Perth Children's Hospital, CAHS and CAMS, so 3 separate streams that all sit underneath the Child and Adolescent Health umbrella. All 3 programs are a 12-month program, and they include a comprehensive orientation program, a dedicated education team, and a variety of study days across the programs. A little bit more about Perth Children's Hospital Stream. So ours, as I said, is a 12-month program. Within that 12 months, you'll be allocated 2 different 6-month rotations. Now, those rotations could be in a variety of areas. They could be in clinical areas, they could be in outpatient areas, they could be in specialty areas. You would be allocated 6 shifts a fortnight. And those shifts could consist of mornings, afternoons, night shifts. They could be clinic shift hours as well. So you could be working across a multitude of shifts at PCH. You have a dedicated transition to practice program team, which includes myself as the nurse educator coordinating the program and coordinating the participants of the program. You have a clinical nurse educator available to you, which can provide some one-on-one support out in the areas that you're working. And we have a base of staff development nurses that are dedicated to the transition to practice program that can support you out on the floor clinically. It's a nice big education team for you. When you start the program, you'll be given an orientation. So currently it's a 2-week orientation, and the first week we have all 3 sites together in the first week, and then in the second week we break out to more site-specific orientation. Your program will consist of a variety of study days, as mentioned, but also what is available to you is 1-hour education sessions called Strive or simulation forums, where we take you off the floor for an hour and do some education and development with you, whether it be in a simulation setting or in a classroom setting. Now, we recognise as an organisation that the transition to full-time studency and part-time work to full-time shift work can be quite difficult and challenging at times. So we actually have a work health, safety and wellbeing team that support our participants through that change and available to us throughout the 12 months that you're with us and throughout your employment at CAHS as well. So I am just going to now hand over to Elise, who's going to talk to you about the community stream. Oh, sorry, how to apply. As Lorraine mentioned earlier, we will be recruiting through Grad Connect. Now, as it was mentioned, 15th of March is when the recruitment date commences. From that recruitment, you will have a start date of either August 2024 or February 2025. So the PCH stream actually has 2 intakes, and it is you'll need to select the option CAHS Perth Children's Hospital stream to be selected into the PCH stream. If you need any further information post the breakout session and the Q&A session, there is an email there available for you that will email through collectively to either myself, Fran, or Lise, and one of us will respond to your request as well if you need be. So now I will hand over to Elise, apologies about that, who's going to talk to you about community.
Thank you, Shahira, and good morning to you all, and thank you again for joining us. Again, I'm the nurse educator for the Transition to Practice program for community health, and I will just give you a quick run through of what that looks like. So we just have 1 intake for our community health program, and that is in February for 2025. It is also a 12-month program. And we do 8 shifts a fortnight. So that is Monday to Friday, 8 shifts out of those days. And that looks like 8 till 4 or 8:30 till 4:30. So there's no late shifts, there's no night shifts, and there's no weekend work as part of the community health stream. We also have a comprehensive orientation and clinical skills week. So we will join with the mental health grads and the PCH grads for 1 week at the start of the program, and we'll do a combined orientation. And then we will break out into a specific community health clinical skills week, which is tailored towards the work that you'll be doing out in community health. And that is conducted by our learning and development team, which sits out in community, as well as our clinical education team, which also sits out in community. So that's teams of staff development nurses and nurse educators, and then myself as well. So again, we also have a really large education team to guide you throughout the year. We will have monthly education days. So that's an opportunity for us all to come together as a group, because obviously you've seen the map, and when we say that we're CAHS metro-wide, some of you will be hours, apart from each other if you're based at Joondalup or based at Mandurah. So these monthly education days are a great opportunity for us to come together, and we will focus on whichever rotation you're in for those education days. You've got me as your dedicated TTP nurse educator, as well as the teams I've mentioned before, the learning and development team, which is also a team of nurse educators, and our clinical education team, which is staff development nurses, all to help guide you through the year. Linked with our program is a graduate certificate, so you will study that throughout the year that you're on the program, and what that enables you to do is to apply for child health nurse roles at the end of your program. It is super valuable. It's a busy year, but it's a certificate that is so great to have. As it says there, we'll work in a variety of community settings and services. If we flick to the next slide, thanks Shahira, I can expand on that some more. So the three sort of main areas of community health, we have school health, we have child health, and then we also have other services. So largely your program is made up of a rotation in school health, focusing on primary school. So what that looks like is that's going into our kindies and our pre-primary classes across all of Perth Metro, and that's doing vision and hearing screening of all of our 4 and 5-year-olds. So it's going out to the schools, it's doing developmental screening for vision and hearing, as well as providing education in the classroom for some of those kids as well. So that largely makes up one of your rotations, and then we will try as best we can to place you or to expose you to high school health and education support services as well. Then your second sort of main rotation is child health. So what that looks like, that's working in a clinic that is doing what we call universal contacts or developmental assessments of our babies from when they are born right up until 2 years of age. There's a set schedule of appointments that we conduct, but then our service is open until these kids go to school as well. So the last official appointment is at 2 years, but then our service is open to kids beyond that until they reach school, and then our primary school nurses will pick those children up. As part of our child health service, we also have a breastfeeding service, so that is nurses that specialise in breastfeeding and support our mums to continue to breastfeed. And also we have an enhanced home visiting service, which is a service that deals with our more complex families, or families that maybe have difficulty coming into the clinics, or just need that little bit of extra support to what the main child health nurses can provide. The other services that we have there, also Aboriginal health, refugee health, immunisations, nocturnal enuresis, and our child development service. Again, they are areas of the service, and we will try and expose you to each of those areas within your program. But again, your main specialties will be in primary school as part of the school health area, and child health. Thanks, Shahira, for the next slide now. So how can we apply for the community health stream? So again, through Grad Connect, you will select the option CAHS, Child and Adolescent Community Health Stream. And we just have one program intake date, and that will be for February 2025. Again, you've got the email address there. Note that down now while it's written up on the screen. And like Shahira said, you can email that address, and either Shahira, myself, or Fran will respond to you. And there is also a contact number there if you wish to speak to us also. Thank you very much. I will hand over to Fran.
Hi, good morning, everyone. Thank you again for joining us, and welcome. It's great to be here this morning. So my name's Fran Schroeder. I am the nurse educator for the CAMS Transition to Practice program. So just a little bit about our program. So we have a 2-week comprehensive orientation which, like Elise and Shahira said, will be joint with the first week in particular with the PCH and community health group intake. However, then in the second week, we will be providing the program participants with some CAHS mental health clinical skills training. So that will be in relation particularly to the mental health stream of the program. We have 2 6-month rotations in which you'll be based within acute, specialised or community services within CAMS. And we also have a dedicated nurse educator who's myself, and I will guide you through the programme, helping you to meet your educational requirements throughout the year. We do have monthly education days, which will support you with meeting the educational curriculum needs throughout the programme, and also a graduate certificate attached to the programme, which again, we will provide some time on the educational days to support you with this programme. We do work, if you're part of the programme, you will have the opportunity to complete rotational roster hours. So you may be on a Monday to Sunday roster, which may incorporate AM and PM and some night shifts, depending on where you're allocated for your rotation, or you may be in a rotation where it is clinic hours, where you'll be working Monday to Friday. Thanks, Shahira.
Oh, sorry.
That's okay. All right, so just a little bit about the rotations which are included within the mental health stream. So there's a variety. You may be placed with acute CAMS, which would cover the Ward 5A at PCH, which is the mental health inpatient unit, or you may have the opportunity to be part of the Paediatric Consultation Liaison Service, CAMS Crisis Connect, or the Eating Disorder Service. You will or may have the opportunity to be placed in a specialised service, which would be Pathways or Touchstone. And also we have a range of community CAMS services, which are outpatient services, which are across the Perth metropolitan area. And these offer the opportunity for you to be involved within mental health assessment, case coordination, and working within the multidisciplinary team to provide treatment services for the children and young people experiencing severe, complex, and persistent mental health challenges. Thanks, Shahira. So again, as we previously highlighted, similar but slightly different with the application process. So if you're applying to the mental health stream, we would ask you to go to the Grad Connect website, making sure that you are going to click into the CAHS Child and Adolescent Mental Health stream if this is the one that you are applying for. We do have 2 program intakes in August 2024 and February 2025, same as the PCH stream. And following, as Shahira said, if you do have any further questions, please get in touch via the email or the contact number there, and one of us will reply to your questions. Thank you.
I'm just going to, there's a couple of questions popped up in the chat here. So Rebecca, unfortunately we don't employ 1.1s directly into the hospital without the grad program. Our casual pool requires you to have at least 12 months of acute experience before you can join us without a grad program. And then just in the Q&A, the guarantee of employment post completion of your graduate year. So we do everything we possibly can to assist you to find employment post the program. And we're not going to spend 12 months developing you and not try and keep you in the program. So we do everything we possibly can to assist you in gaining employment in the CAHS service after. This question about first preference as one of your preferences and then another stream as a second preference. I don't think that's going to be possible this time round because of the way it will be in Grad Connect, but that might be a question for the Grad Connect group like Lorraine or Jenny, but we can potentially look at that in the breakout session. Allocations for rotations to graduates is a very fair and equitable process, and it will be adopted across all 3 of the streams as to where you're placed, and each area you provides a privileged opportunity to develop transferable skills and experience within your paediatric and adolescent nursing. And as a beginning practitioner, you'll gain valuable skills and knowledge to integrate theory into practice regardless of where you're allocated. Down on the right here, we've got Elise, did you want to answer the community health question? During the child health rotation, do you stay at one clinic?
Yeah, so look, ideally we like to have you placed at one clinic, but obviously we need to have you with a preceptor, and sometimes your preceptor may not work, the exact days that you are working. So then we would allocate you a second clinic to work from. So ideally, yes, one clinic, but then also if you are based across a couple of different clinics, it means that you're exposed to different nurses who practice differently to maybe what your preceptor does. So it all becomes a really great learning journey for you. But obviously that clinic would be in the region. So in each region, there are multiple sort of child health clinics and school health bases. So the clinic, if you're allocated to a second, be within close proximity to your first one as well. I hope that answers that for you.
Another question here, neonatology is an area for allocation within the PCH stream. Key tips, maybe we'll do that in the breakout session. So come and see us on level 2. So the 3 of us will be up on level 2 in the breakout session, and we can have a chat about that in that session. Theatres, yes, theatres is also one of the rotations available within the PCH stream. Unfortunately, we don't offer an EN graduate program at this stage, so you won't be able to apply for the PCH stream or the CAHS or CAMS at the moment. And if experience in overseas as a nurse or doctor will be beneficial in grad program, if it won't be counting at all to apply in CAHS. Do you want to come and see us on the level 2 breakout session, and we can answer that one then? Is there any more questions that we can answer at present? What graduate programs can ENs apply for? That might be a question for Grad Connect. All right, thanks guys. It was lovely to see you all or speak to you all. We look forward to seeing you on level 2.